The Indian health IT market is actually IT is as an industry a reactive force in many cases to the way the industry itself shapes up, and we are probably no different than any other aspect of the IT and technology business. Very remarkable, the Indian healthcare system today is predominantly privately funded and being pushed by private players more than the public, as opposed to if you look at developed countries, whether you take continental Europe or US or Australia, Singapore even, or Turkey and the other places that we work in like Saudi Arabia, they have universal health care, which means the government takes the burden of providing health care to all the citizens in the country. Whereas India is the other way around. I think the public health coverage, I think, addresses between 10 to 15% of its citizens, whereas most of the citizens are today left to their own funding, their own devices to kind of manage their own health. So this has led to a very interesting situation where there are 80% of the market coverage provided by private players. Now that's both good and bad, and that leads to a lot of technology innovation. At the same time, it leads to an extreme competition and pricing pressure where sometimes quality is given a short shrift as opposed to thinking and planning for a longer term. Napier is a global organization headquartered in Singapore. That's where my leadership team is. We have offices in US, we have offices in Singapore, of course, and that covers the Southeast Asian countries. The Indian operations actually help us cover the SAARC countries. We have office in Saudi Arabia and Africa in Tanzania. That's where we operate. We are also having a presence in Turkey very soon. That's going to be operationalized next quarter. Uh, the Indian market is very interesting for us because it serves two functions for us. One is it's also the place where we have an offshore development. I have a little over 300 people here that are actually from the industry. There are many doctors, nurses, physiotherapists, and allied health professionals who work for us, helping us understand what their counterparts in the hospitals want, so that we can apply technology innovatively to solve their problems. Besides, we also use the Indian talent pool to do a lot of our projects overseas. So that's kind of where the role of India is in our global business. Let me maybe take you back a couple of years. We've been in this industry since the mid 90s. In the olden days, the hospitals, all that they were interested in is how do I manage a patient who walks into the hospital. And so all our solutions, all our products were tailored for helping a hospital and its key stakeholders overcome their operational challenges. So we had products like the HIS, the LIS, and the EMR, which is the hospital management system that manages the admission, discharge, and transfer process, or the lab equipments and the lab results, and the electronic medical records, which are more popular these days than they were in those days. But these solutions are all still what I would call as within the four walls of the hospital. Interestingly, because of consumer activism, changing consumer choices, a lot of it driven by internet, the consuming patterns of a patient have also changed. Now, the patients also want instant access to healthcare services, preferably in their own homes, the comfort of their homes or their workplaces. They don't want to travel out 2-3 hours to go to an acute care facility like a hospital to get their services. So what's happening is the hospitals are now being pushed by market forces to react to that changing trend. So you will find hospitals reaching out to the community in more ways than one. Some call it M-Health, which is the mobile health. We have other solutions like the telemedicine, which actually builds a very strong connection between the patient in the home and the doctor, the nurse, or the attending healthcare professionals in the acute care facilities. In addition, we have solutions that are meant for extending the hospital's reach into the community, like the referral management solution, like the chronic illness solutions. These are all things that have also been shaped by the fact that If you look at India, 50 years ago, people were dying of diseases like malaria, gastroenteritis, and those kind of things. But increasingly, the epidemiological changes have actually forced them to look at lifestyle issues and diseases like diabetes, asthma, COPD, or osteoporosis, or those kind of chronic illnesses. The that also is a reflection of the wealth of the society. So we have products for all of these, namely the chronic illnesses, for the telemedicine, for the referral management, and some of the other community required solutions that extend the hospital's services into the community. Challenges are there in every market, and being a commercial vendor in the space, it is but natural for us to expect challenges. But India is very unique in more ways than one. Like I was sharing with you earlier on, the predominantly private players being involved in the healthcare ecosystem here also drives a lot of the consuming patterns of the patients, and also consequently the pricing. The pricing pressure is the highest on the hospitals in India than I have seen anywhere else. Consequently, that also translates into a lot of pressure for the vendor as well. Technology is a strange business because technology requires someone like us to make upfront investment of millions of dollars and then try to recoup it through a combination of licensure and also services. But when these kind of pressures come in, then you are not able to invest so much innovatively in technology. So what you will find is established players have the difficulty of having built a technology, not being able to make it profitable enough. So I think the challenges we have is twofold. Therefore, one is the hospitals themselves and their mindset in not wanting to look at technology as a competitive differentiator. Uh, Hospitals are slowly warming up to the idea of using technology as a revenue generator, not as a cost containment initiative. So, until and unless hospitals change their mindset, these pressures on the vendors will continue. India is very interesting, again, from the fact that if you look at telemedicine, I think it has one of the better rates of penetration in India than elsewhere. But I think that's because necessity is the mother of invention. You have to reach out to a large hinterland of population that is unserviced by healthcare outreach. So I think telemedicine is probably far more advanced and used in India on more sustained basis than anywhere else. In this regard, I would also like to point out we are very honored because we launched telemedicine in India in 2002. The then president Dr. APJ Abdul Kalam, who's no more, was actually the one who inaugurated that telemedicine initiative of ours along with one of our hospital partners in Hyderabad. So he laid out a vision for us which kind of has panned out in more ways than one. So that is an interesting aspect of the Indian healthcare system. But at the same time, Indian healthcare system also has certain other inefficiencies. There is a lack of policy framework that leads to inconsistent quality outcomes. For example, in the US, the Obamacare clearly stipulates under the meaningful use stage 2 that is currently in progress there, how healthcare providers must capture medical records, data there, and ensure continuity of care across care settings, which is a far cry from what is there in India today. It is still a very ungoverned, managed kind of landscape in India. India is what I would call as a frugal innovation market. So, in the past, what's been happening is we have always done things like this because we are a global player. In Singapore, we are seeing developed countries and developed healthcare solutions we have always tried to share the best practices. So we learn from markets in US, we learn from markets in Singapore, we learn from markets elsewhere in the world, and then we try to bring some of those solutions here and try to tell hospitals this is how the rest of the world is looking at. So hospitals get a chance to benchmark themselves with globally best practices like the meaningful use certified version of our products. For example, if a hospital in India wanted to be exactly offering the same level of quality like a hospital in the US, and I have a solution for that. You do implement that HIS, that is meaningful use certified, you are there. It helps a lot to bring medical tourism into the country. So that's one way of looking at it. But now increasingly what I am seeing is the Indian market is also forcing us to adopt and adapt to this way of thinking of frugal economy, economical innovation. And so I'm going to see next 5 years a lot of my ideas on technology and application of technology, its innovation being generated in India but going to the rest of the world. So it's what I call as the reverse flow of innovation, and that's my hope, that's my expectation, and I'm sure the Indian market is moving in that direction. That's our view of life.